So those of you who can stay will have question and answer now, and I'm going to work through the questions in the chat. I'll invite those of you who typed in questions to unmute and actually ask your questions if you're comfortable doing so. If not, I can read the questions to Emma, and sometimes Patty will chime in, or Brian if he's still here. So we're going to start with, I just want Stella and family to go read the chat because there's so much love for you. So make sure to read that, and I'll capture it and send it to you as well. I'd like to start with Flora's question. Flora, are you available to ask it out loud?
Yes.
Great.
Hi. Yeah, my daughter, she has a right side brain injury, and her speech is okay. Well, in general, she talk, express herself, and except for some high level functioning like expressing complicated thing or what happened in a fight with her friend, something like that. So she sometimes try to avoid saying that. Well, that I think it involved sequencing and abstract thinking kind of thing. But the main puzzle to me is, you know, I sometimes ask her, what does she feel like? Do you feel sad? Maybe physical or emotional. Sometimes even ask her whether she feel cold or sometimes she feel tired. She mostly she answer, I don't know. So my question is, whether is it about her speech expression, she couldn't express herself, or is it she's lacking of some kind of feeling about herself? That's my question.
That's because
That's a great question. And when you say lacking feeling, do you mean like not able to, and Patty, you can chime in too, do you mean lacking sort of the sensory input, like doesn't feel hot or cold?
Yeah, sometimes I do question about that. Even though, you know, sometimes she needs to go toilet, she doesn't feel it until she needs to do it. That kind of thing.
no, that's normal.
Can I ask how old your child is? You may have said, I may have missed
yeah,
it.
she is 13. She will be 14 in June.
Okay. Well, so when we, and Patty, Mara, feel free to chime in as well. I often think of it, if a child is struggling with something, I think of what are the contributing factors, because oftentimes it's not one thing. It's not she doesn't have the words or she doesn't have the feeling. Oftentimes it's, you know, multiple buckets. There's several things that are contributing to it. So in that case, it could be reduced awareness. It could be reduced expressive language skills. So she doesn't have the ability to formulate that sentence or that vocabulary. Could be a social communication skills. You know, she understands what she's feeling, but she doesn't know that she can tell you. So it could be, there could be multiple contributing factors. And so we want to give support around different areas. Yeah. Patty, did you have something to contribute?
I think, thank you, Flora, for the question. I think it ties on this aspect of communicating is not an easy thing to do. And I don't know if you guys want to take a moment and pause on how much sometimes it's difficult for ourselves to express when you are in an emotional state, when there is something else going on. If you're angry, you may not want to say things, and you may want to say other things that are necessary for the event. And that's very difficult to control, even for a mature adult.
Yeah.
When you're developing your brain, and Flora, for your child, she's 13. So at this time in development, there is a walking change of hormones going on. And they are learning to socialize in a very different way, because now it's about identity creation. And I would add that there is so many changes. That's what I'm trying to say, that it will probably, because of the stroke, what I want to make sure here we hint on is the stroke might have slowed down some of the processing speeds, okay? And sometimes even just giving the time for her to formulate or to take the question that you ask, it might help. And I think Bonnie was going at that with how she does it with her daughter. Sometimes you can resource to some sort of like, give me a moment, or I don't know. And I don't know will be not the end of the conversation, but it's that time that they are taking to put together what they want or can say about it. The other thing is what Stella has done, which is sometimes it could be as simple as this.
Yeah.
Don't ask for a teenager, even without any stroke. Sometimes this is as much as you're gonna get, or a face, okay? So, and that, I wanna say the developmental stage is very important. So if it's difficult for a grown-up, completely myelinated brain, frontal lobe, without an injury to the brain at any point in childhood, to communicate while you're having emotions, it could be even more challenging for someone in this very wacky developmental stage. I say wacky because it's dynamic, and what it works today, it might not work 2 weeks from now. So you have to experiment with different things. But I think giving a pause and agreeing on you not asking or not feeling. I'm gonna say something almost for sure. I'm 100% sure she feels enough, and probably a ton. But cognizing and knowing what to do with it, and what to do in the setting of communicating to mom, it will be a different thing. So I wouldn't underestimate that she does have an understanding and a whole experience. What I would think is that the way that she is expressing is taking its own path. And if you need to communicate with her because you may want to get her to go somewhere, or you need to like arrange dinner or something, or you want to know if something happened at school that she is not talking about, then maybe agreeing on some of these cues of like giving herself a little bit of time, and then just using other ways of communication. Is it okay? Are you okay? And she could use thing. You could do I love that graph that Stella developed, for example, and these could work for some teenagers. Sometimes it's going at it in a very oblique way. When you see them struggling, it may not be the time to ask directly because there's a little bit of overwhelmness. But it might be that you just observe that and say, hey, I noticed your face was something going on? Like what was going on then? And maybe in a separate time, she may be able to recap some of her emotions. But you're dealing with a lot of the questions that parents of teenagers have, but also on how to link it on if that is related to the stroke or not. So an excellent question. I thought it was great that you asked us.
I actually want to tell a story on this, and then we'll move on to Lauren next. So my daughter, Mia, who was in a couple of the videos, she's now 11. And we had an experience recently where she was quite upset at bedtime. And she actually went and got the computer and wanted to explain something to me. And I just had to wait. And she typed for half an hour. And after she handed me it to read, we were able to have a conversation about what was going on for her. So this is a child who's able to express herself in writing. And sometimes for her, the path from her brain to her hands to type is easier, especially when there's emotional content. Once it was out and it was, this big boulder of what she wanted to talk about, then we could have a conversation. And I was blown away that she used that. It was almost in a panic. She went and grabbed the computer, and I didn't know what was going to happen. And so it was the first time she had done that. So again, that's just emphasizing what Patty was saying, that there are lots of ways to communicate, and echoing back to Emma's presentation. There's all kinds of stuff going on for our kids. And so really holding the space that you believe in them and their ability to express themselves. And it might take longer than it does for us or than it does for a similarly aged peer. So be patient with yourself and with your children or the children in your care. So I'm going to call on Lauren. Are you comfortable asking your question about sign language? You're muted.
Yes, thank you. I was asking more generally because my son's 11, so we're sort of past the point of sign language. He's very chatty now. Not always comprehensible, but that's okay. But I was just curious because it sometimes pops up in conversations with other parents. There are people who seem to think that sign language is bad, just in the sense that it sounds like it can sort of get the conversation started, But is there ever a concern that it could take over? Like that it would sort of, instead of like developing language, a child would just sort of rely on sign language instead? And is that a bad thing? I don't know. I'm just curious what your take on that is, Emma.
That's a great question, and it's a really common question. And the short answer is no. It won't interrupt spoken language. In anything, you know, my experience again is in the younger population. So I have a lot of parents asking, if I teach them this, are they just going to rely on that versus talking? And we actually see some research showing the opposite, that once, again, thinking of it from this communication lens, once the child has the ability to communicate in whatever modality it is, it sort of opens the floodgates. And signing can actually lead to more spoken language if that's what we're looking for, if that's the goal. And I fully support for kids giving them access to multimodal communication. Like Mara was saying, in this emotional state, it was easier for her daughter to type, to write. Same thing if you have a child who is, you know, maybe struggling with some of the emotional context to get words out. Go ahead, write, sign, draw, do whatever it takes to get the message out. So that's my short answer.
Yeah, great, thank you.
And I would say sign language for an 8 and a 12 and a 13 could be awesome. It's just like these things of agreement that we were talking about. Like,
Yeah.
like, do you need a moment? Like, do you need a pause? Like, it doesn't have to be sophisticated American, whatever.
Yeah,
very
I do this to my boyfriend all the time. I'm like, no, don't talk to me right now.
So I do think it's very important. And also I want to take the opportunity, thank you for asking the question, Lauren, to also touch on multiple languages in the household. A lot of the videos that you've seen are households where there is more than one language and it's very diverse, like Mandarin, English, or English and Spanish. We value so much for brain development. Remember that it's not about the very specific thing. If we box our kids on task performing subjects, okay, like moving the hand or speaking words, we really are forgetting how the brain works. The brain does not learn by subject. It learns by experience. So if you have the ability to communicate and you are much more emotionally connected to a language and you're talking to that kid in that language, it has been shown it has more benefits than trying to diminish the language fluency or cadency or melody and using a language that is not your own to teach the kid. And I know that some school districts do have in their approach for kids with a stroke to recommend that it's only one language spoken in the house. What I would say is take the trade. Exactly. Emma is signing here. No, take the trade of maybe English language may come a little bit later than the kids in his classroom. I would take that trade because the research shows that later on they will be able to do whatever languages they're doing at home, plus the English in the same fluency and vocabulary capacity that their classmates. And this is without stroke, the data I'm talking about. And with a stroke, I would emphasize even more. Communications is way more important because at the moment that you're talking and your kid is expressing, if he can communicate and you feel comfortable communicating, there is a lot of very different emotional states. So learning opportunity is much bigger for whatever you're doing with the hand, for the play, for the trunk and the muscle tone. There is a lot of other things that rely on being able to communicate. And frustration, which will happen through toddlerhood as a norm, that they will get frustrated, has a lot of other outflows if you give them more than one way to communicate. And this includes pointing, sign language, and using whatever words or sounds even sometimes. So don't be too focused on when do they speak the word and how many words together and the language and the sentence, because that's not the objective. And trust that if you are successfully communicating with them, they will be massively in advantage of learning and learning language in a much more proficient way. That's gonna be my pitch.
Emma, did you want to add anything to that?
Oh yeah, if I could go outside with a giant sign that says bilingualism doesn't cause language delays, I would. It's even for children with brain injury, even for children with developmental delays, There's no research showing that exposure to multiple languages will cause language delays. That's my takeaway.
Thanks. So I'm going to ask Judy, are you still here and wanting to ask your question as a practitioner?
Hi, thanks again for this. This is great. Out in New Mexico and very far from many services. So I'm recently just got 2 children who had neonatal strokes. One is 28 months and the other one is about a year. What can I do? Because speech is not on board yet, if ever. We just don't have one. What other things, and I'm looking at your list, Emma, of pictures and books. Is there something sort of that I can encourage or show or whatever to help with language development? Kind of just always give this to the parents, on these young children. I'm an OT, so that can help with language development without a speech therapist on board yet.
Sure. Yeah, absolutely. That's a great question. And I think my response hopefully will actually touch on a couple questions that I saw in the chat too. Someone asked like how early they can start doing sign language with kids, and as early as you want, as early as possible. Doesn't even have to be formal sign language. It can be gestures, as long as the gesture is sort of consistent. So working on things like pointing, waving, shrugging your shoulders, in addition to formal signs. It's really easy to look up sign language online if you just want to give it a quick Google. That can be started really early. And someone else asked about the relationship between play and language. And I'm sure as an OT, you know the importance of play and different types of play on development. And play and language, play and communication are really interrelated. So if you're working on play skills of any kind, you're also working on language skills. So if you have little ones and you're working on cause and effect is also a communication skill. If you're working, with a cause and effect toy, for example, I press a button, something pops out. You're also learning that idea of I do something, I get something. I sign something, I get something in return. I say something, I get a response from someone else. So it's teaching that turn taking back and forth. And in addition, while you're playing, making sure that you're modeling either the verbal language or the signed language along with whatever task you're doing. So giving them the language input along with the play input.
These are excellent recommendations. And also I think, Emma, you flashed through that slide that have resources where you can also go tap and get some of the communication skill, like boards and stuff. Like, I think that will be something we will have. We will try to add handouts to these talks as we grow in complexity. Or people like you that are trying to work in an early interventions or in an environment where you have one champion on taking care of the kid therapy, and we want to empower everybody here, and not only the families and the parents. One other thing that I will add is the one thing that may be very tempting for parents to do is this is a cup, and this is blue, and this is white and black, and labeling what the kid is looking without the kid engaged in doing something that has that return, the purpose that Emma is talking about, may just blunt the experience they're having. We don't know what they are doing when they're exploring something. So it's not about labeling everything you see around them in terms of learning new words and trying to get those things. It is much more effective when you are talking about story. And then you're saying, I'm drinking my coffee from my cup. And these kind of things are much easier to be cognized as language and as words because they have a purpose and they have a usefulness. So this is the blue block, and these kind of things, very structured, does not necessarily help because it's just a number of other words while the kid is trying to do something might not be exactly what he's interested in at the moment.
Thanks, Patty. I want to let Maggie ask her question.
Thanks, Mara. Emma, this has been so incredibly helpful. Thank you so much. My son had a perinatal stroke on the right side of his brain. So he is a left hemi, and so as a result, like his language has developed quite a bit and he's making progress. But I guess what's really difficult for me is knowing he hasn't qualified for speech therapy because he keeps making progress like along. And I loved what you said about stages and not ages. But then what's really difficult for me is like knowing what is a thing where I need to intervene. Like what is sort of like appropriate for where he is and what isn't, and where I could use some more help. So I am going to pursue we're here in Boston, so I'm going to get a speech evaluation with Boston Children's, but I guess it's just been frustrating because like compared to his peers who have not had brain injuries, like he is like not speaking as much as them, but like he is making progress. So it's hard for me to know what to do, especially without any support. So I guess like what suggestions do you have? What next steps might you consider?
Absolutely. Well, first of all, great to hear that he's making such wonderful progress. That's fantastic. And that you're being such a good advocate for him. So I think you're taking the steps that you need to take. Like I said, you as his parent are the expert in your child. So if you feel like I need some more support, I would feel better if I had a second opinion. By all means, you really want to be that advocate for your child. And you, instead of, you said he didn't qualify for speech through early intervention. So you found another avenue to go get it. You are getting an outpatient speech and language evaluation. So I think you're right on track for what you should be doing. And it's hard to say because it is this question of we're measuring the child against themselves. They're making progress. You know, they're happy, they're functioning, they're able to do what they need to do at this age. But I understand that desire but they seem behind their peers and we want them to catch up. And I think that's, you know, you as a parent are going to have the best instincts about, you know what, I think my child has more potential and needs a little extra support. I feel like that maybe was kind of a non-answer, but I hope
I mean, it's hard, like from what you've said, you're like, each kid is different. Each kid sort of develops on their own. So I totally,
Maggie,
I get what you're saying. Yes, Patty, sorry.
I think Emma is bringing something. So guys, your instincts are real and I think they're very strong. So if you are feeling that there's something else that it could be happening, it's probably right. Okay. And even if it's not the case, when you had this conversation with an expert in speech, in development, which you will find because they're in a good place to be, it will be the person that you can, even if you're not in therapy with them. This happens with a lot of the kids that we have, that they are in early interventions, but our speech and language pathology are checking on them like every 3-6 months to make sure that there is a maximization of the resources that are available to them. Because a lot of them are not right here, like also, like they're not, like you are in Boston, but there are a lot of families that is too much driving to come to the speech pathologist that can do the therapies. So they try to guide the early interventions specialist. They try to guide the person in school sometimes when they're working with the school, or they make a program for him. But what I'm trying to say is that it could be your guide. Even if you're not ending up in a speech and language pathology therapy in a regular basis, but it could be also that thing that takes the concern away and it allows you to freshly look at him and not be concerned about something. I think that's totally valid for anyone to seek. The anguishing anxiety, unnecessary suffering of not knowing if I'm doing the right thing or the wrong thing is part of parenting. So whenever possible, ask for help. To have someone just give, and not seeking to overcrowd and make the kid perform in any way, but it's also for yourself that you need that second opinion or someone else to put eyes on him.
Also, I know Maggie is a teacher, and it can change at ages and stages, as you know. And so
Yeah.
like for Mia, she was on track with language, but I always had a sense that there was something off. And it wasn't until she was 8 that she had her first central auditory processing evaluation. And
Yeah.
now, even at almost 12, we're still understanding the layers and layers of how that affects her ability to process and produce language. So it's not a fixed thing. It depends on what the environment in it is like. When the kids are very young, it's a very multimodal environment. As they get older in school, it's much more people talking, at children. And does that work, or do they need a flipped classroom, or what's the environment? So really pay attention at every stage.
That's helpful. Thank you, Maura. Thank you, everyone.
I'm just going to ask Lauren's quick question. When, Emma, does a delay become a disorder?
That's a really great question, and there's debate in the field about how we talk about that. And there's no fixed answer. Generally, once a child is showing maybe more pervasive or long-lasting challenges into that middle childhood, sort of elementary school age years, we may start using that terminology, disorder versus delay. Again, it's semantics. Disorder tends to indicate something that is more pervasive and that we may need more of those compensatory strategies for.
And Lauren, if you're still here, I saw you have another question about imaginative play.
Hi, I'm sorry. I don't want to, I was, sorry.
Sorry, I heard my name. Is it talking about me?
Oh, is it? Yeah, I just wanted to quickly ask about, is there a link between lack of language and the fact that some of our kids just really don't get into imaginative play? Like my son is very concrete. He's never gotten an autism diagnosis, but he definitely is in the neighborhood. So I'm just sort of curious about that. Thank you.
Sure. Patty, you can speak to that if you'd like to, or I can hop in.
So I think imaginative play may be happening in ways that is not so much in our face. So I don't know your son and specifically what we are talking about in this regard, but what I would say in general is that every kid will have a different way at expressing an interest. And there is also gender differences that are somehow known to kind of flip back and forth in terms of more accent to the motor skill and the motor exploration versus the language exploration. And it depends on the personality of the kids. There are kids that are more like into observing and they tend to go into language before they do the motor. And there are kids that are all moving around and speech doesn't come until much later. So there is a lot of variation, but and the autism spectrum thing, it comes like I have a lot of my stroke patients that if they get a neuropsych evaluation, they get the developmental disorder diagnosed. The one thing that I want to say, when those batteries are done, they're not done for kids with a stroke. They weren't developed for that. They were developed for, in general, learning disabilities that are not with a focal brain injury. What I'm trying to say here is, if the label brings you resources and services, I welcome the label. I don't want any kid with a stroke ever to be boxed into it has autism. It helps to find the community. It helps to find the resources. It helps to get you the insurance to pay for things. But stepping back and realizing that it's not the same as having a lot of like sensory overwhelmness and whatever it is. Autism is also a bag. There are many different diseases inside autism that are not just a stroke. Then some of them are genetic, for example. But their social communication, which is where we're going at, because it's where the autism disorder starts coming, like less verbal, decrease in what it looks to be the interaction, the eye contact. That's how autism starts getting to be put into the conversation. And then this social inability or social difficulty to express themselves makes them fall into that category. But to be very clear, a lot of the inattention is the slow processing, nothing to do with not being able to do tasks. In the other way around, most of the stroke thrivers that I work with, they're incredibly focused when they get on something that they are interested. And in fact, if there is something difficult, is to switch to the next thing. And there are many others that difficulties like with auditory processing maybe getting on the way when they're older. So they're inattentive, but not because they are inattentive, it's because they can't catch and retain, or there is no enough time because there is a slow processing speed. So a lot of the time is like you really have to work hard on trying something like a therapy that is recommended and seeing if the kid is really thriving with it or struggling with it. That's gonna be my recommendation. There are a lot of things, do not get attached to labels in this realm because they're not developed for stroke kids. Are they useful? They might. I don't want extra worrisome of what could be happening in teenage years if you're being given this diagnosis. Only a very, very, very small fraction of kids with large strokes, with many other risk factors and things that happen to them during the acute period and the first few months after the stroke, develop a full-blown autism spectrum disorder kind of behavior that lasts for their entire developmental stages and into adulthood. The majority of them is all transient difficulties in very different domains that tend to be very well overcome if we can support them in that kind of transitions that they're doing. So don't box them. That's my message here. I don't know, Emma, what you think.
Yeah, I agree with a lot of what you've said, or with everything that you've said. The skills come and go, and I think, you know, in terms of going back to the question of play and language, those things can be related in terms of you need a fair amount of language skills to be able to engage in some different sorts of pretend play. But like you said, Patty, pretend play can look really different, and imaginative play may not look like, oh, I'm going to, you know, play house with my friends. It may be more focused on the child's specific interests. And if that child is more interested in the concrete and the constructive and sort of the logical play, I don't think that's going to impact language or communication development. I think that's that child's preference.
I have a question from Angela that came to me privately. Angela, are you able to unmute and ask?
Yes, I am. Thank you. So I'll just read it. If it sounds like I'm reading, I am. 1 week-old Rosemary contracted bacterial meningitis. There was resulting damage in the frontal lobe. In addition, she also suffered a stroke in the right parietal lobe. Now she's aged 26 months. Her gross motor is delayed. She is using a walker. She's expected to be able to walk whenever. She also has cortical visual impairment. Plus, she is not speaking. She's receiving therapies. She can imitate just a couple of sounds, but the only word she has is no. Her receptive language is coming in at 24 months. And we feel that she truly understands, you know, what we're communicating to her. Is there any way to know which area of damage is causing this, the speech part? And would this knowledge help to inform her therapies going forward? So, neurological question and SLP.
Yeah. I think Patty and I may tag team this. Patty, do you have something you'd like to add first?
Sure, I can go first. I know your answer is going to be more useful than mine. So first of all, it's great to hear how much she's taking on. It sounds like she's working in multiple things at the same time. Receptive language usually, I would say, is pretty much there from get-go in different complexity, but we are not able to assess completely what receptive language it is until the kid can start acting on the environment. So for a baby that is still like not interacting so much with the environment, it's difficult to test even receptive language. But it sounds like she understands.
Yes.
The fact that she has words like no, it tells you that she understood also meaning of the speech, which was the verbal communication. The other part that to me feels that very reassuring, that she's probably gonna have to work. If she had gross motor, I'm very, very comfortable saying that articulation of a speech is gonna be challenging. It's challenging for any kid that has any motor difficulties. So if you see a kid that has hemiparesis or motor difficulty, CP of any kind,
Yes.
you could express that to master these muscles that are teeny tiny in the throat, the tongue, where we produce most of the sound, will be a different challenge than for a kid that did not have a stroke. And in her case, I know from what you're telling me that she has that challenge. So
Yeah.
the expressive language will be later, but the fact that she already understood that she can articulate sound to make a word, the word with meaning, and if she's using the no in context correctly, like no when she doesn't, it is incredibly informative to me. And what part of the brain, the question to the anatomy, difficult to say without looking at the MRI specifically, but because it's meningitis is not only what we see in the MRI, the inflammation was surrounding the entire brain. And some of the nerve cells might have had to deal with that inflammation and have damage that is much more specific and not seen in the MRI. But if there is a focal parietal lobe stroke, as you're saying, in some of the frontal lobe,
Yeah.
what for sure, a lot of the networks that she taps on, remember that when you're trying to speak, most commonly you're processing first information that is coming from the visual and the auditory. These things go to both sides of the brain. They had to cross back into the left side if she's mostly dominant, developing dominance on the left, which I would expect because you're telling me the lesion was a little bit asymmetric, and the right side was more affected than the left. So all of this, and this is what Stella was describing, she's having to do extra to get things to go to where things can be produced. And then when she even gets the words that she wants to say, most likely the sounds and the mastery of these fine motor skills. And hear me talking, I learned English as an adult, and I would never be able to make the phoneme sound like an English speaker. And that's because my ability to learn for these teeny muscles is limited. As if I had an injury, but I didn't. Apparently, I volunteered for MRI, so I know my brain did not have an injury, but otherwise you could, and you don't know. But this is what I'm trying to say, that beyond where it happened, meningitis is a global injury, so there might be multiple things affecting this coming along. Processing speed, I would expect, is delayed and impaired probably. So she may take a little bit longer to process certain things and to produce something of her own. But very importantly, the discrepancy between the receptive and the expressive part of the language that you're referring, I think is very telling us of the same motor compromise that is happening here. No, people don't talk about, it's the same part of the brain that controls the leg and the arm, which is controlling that side of the muscles in the throat and the face. And most of what we do in speech comes from lip, tongue, cheeks, and palate moving. The vocal cords only make two big sounds that are kind of vowels, but everything else has to happen with this tiny, teeny regulation of these muscles. So if I have a little bit of a spasticity in these muscles, it's gonna be harder. She will do it, 100% sure. But it's gonna take a little bit longer to master exactly how to get it out. But I think she does have signs to me that is an exact right track.
So just one other quick additional question. So the speech therapists are saying they have said that they think it, may be what you're saying about the muscles. But would that stop her from making, like, she doesn't make a lot of sounds. She's not babbling or anything.
But
So
she's saying no.
she says no, but you
So,
don't.
I don't know, Emma, go.
from a speech and language perspective, I think there's likely several things going on. Again, going back to the basics of communication, speech versus language. We don't know yet it sounds like with this little girl, where again, it's contributing factors. It may not be one or the other, whether this is more of a speech, motor, muscular issue or a language, like her understanding of how to use multimodal communication to get what she wants done or to communicate with the world. it's likely a combination of both, it sounds like, and based on what Patty's saying in terms of the, you know, the neurological factors, the location of the injuries, the structures. So I think what you're, at this age, if she's not babbling and imitating and making as many sounds, it is an indication that it might be more of a speech issue. So more of that neuromuscular control of the lips. But the treatment at this age is still going to be really multimodal. We're not going to be sitting there having her do exercises with her mouth. It still has to be really functional. And I would really encourage use of that multimodal communication. We don't want to focus too much on the speech, on the moving of the mouth. We want to give her lots of ways to communicate her language abilities, whether that's sign, picture, gesture, facial expression. We want to give her outlets for that so that she can develop the speech and the language at the same time.
Okay,
That would be my input.
thank you.
And as she's older and as she, you know, as she just matures, it may shift to focusing more on, let's work on some very specific speech sounds.
Okay, thank you.
Bonnie, are you still here?
Yes.
Go ahead.
Well, you already discussed the play, so I'm going to jump right to space because I think this is what I'm thinking. My son was in utero, right? So it wasn't a stroke though, but the first was in utero. Anyway, so I think that when things happen pre-speech, and I'm going to go 3 rather than 5 because there's a lot of prepositions that come in by 3. I think that impacts the play because of understanding space. And Stella was kind of like the Jill Bolte book. Stella was just amazing, or like reading something that Luria wrote, if you know him. But she was just amazing about her ability to use space to think about how to access a word. I'm a terrible speaker. Am I making sense at all?
I am following Bonnie a little bit, I think, what you're saying, and I totally agree. And this comes back to all the other workshops that we've been talking about. Like, the way that we learn is not a single modality at any single time. And in fact, when we were talking about visual spatial cortical processing, we even speak using what you're talking about, this spatial representation of things. We use a lot of space representation, and there are some of the lesions, if they fall in specific networks that are very much involved in visual, spatial, and spatial recognition, but not to know how far something is, but to construct it inside your head. Like to have your own little room. Like if you heard Stella, she has her own little city, like in a room and stairs and elevators. And that really helps because it is basically using what is around us to make sense of what is happening inside us. And I think this is what you're going at. I completely agree that the ability to map things is something that develops, is critical for all domains, not just speech, not just vision, not just communication. It's critical for motor planning. It's critical for so many other sensory modalities. But mapping is in fact what the brain is trying to do throughout these very early stages of development. And it brings me back to what happens after you had a stroke and you're older, if you were in development. We try to go back there to try to recreate the developmental stages. Because trying to ask Stella to speak in full sentences or making her repeat after word after word after word is not the way she was gonna get her speech back. And you heard that at the beginning was reading to her, letting her experience those stories that she was able to still understand and she had a relationship to. And this, I think, applies to each kid separately, but that's why we decided to focus a little bit on the stages of the language acquisition, just to make sure that we try to recreate that when there is injury to the brain. So I don't know if it took what you were trying to say too far, but I was trying to see what this has something to do with your space conceptualization.
Well, I just would love to see speech. I used to do evals for intake of early intervention with a speech therapist, and I was so frustrated because to get the speech therapist interested in a child before the age of 2, I'm so glad you're doing this, Emma, collecting data. You don't have to know what you're doing. You have to collect data to justify that speech to get in there, for goodness sakes. But I do think the things that a lot of our kids are missing, and I wish I had known this, 20 some years ago, was that early correlate between language development and space. Who knows? It could influence auditory. I'm sure it influences auditory processing. Let's get real here, and maybe it influences ability to distinguish relevant sounds, salient language sounds versus a fire truck or those doggone lawnmowers. Anyway, so.
And I think to tell other people, there was the question about early interventions. So one thing that I see commonly with kids that have milder forms of motor impairment is that early intervention signs off before they even have a speech development. So no, anyone that had brain injury during any childhood early development, like less than 3 years of age, should at least be having a monthly evaluation. And the reason is that the domains and the difficulties may not be there until they start arising in the development. So for all the parents in the call, don't let your early interventions drop you. Have your neurologist inform the early interventions that what they're dealing with and what they should be watching for, because that's very helpful, that crosstalk. And second, without early interventions, the transition to the school system is really tough to do as a family. So you really want to have your team with you as the kid starts to go into the school system, to inform what other things need to be looked into, to get the neuropsych evaluations that earlier than usual, okay? And I think that's a very important point that was asked also in another question in the chat. And you will have to ask for a speech and language development as a separate evaluation many times that is not included in the early intervention skill set that the therapist has, as we were seeing earlier.
Agnieszka, are you available to ask your question about your son?
Yes.
Did you say
Yeah, hi. Yeah, just quick question. My son is 5.5. He's expressive language delay, pretty bad. He's uses simple sentences, and he's very good at home, kind of getting his point across with his sister. He has a year younger sister who's been just amazing. But at school, he's silent. Like, he does not talk at all to anybody. He has no friends. I don't know what goes on at school other than if I text the teacher. And I'm just really worried about his social development, and because he's always by himself, he's always has been. And also in addition, he's also shy and quiet. So he's shy and quiet, and his speech is really behind. So any advice, any kind of thoughts on that?
One thing that popped up for me when you said this was something we touched on a little bit earlier about the role of environment, context, and emotion on communication, and how expressive language is not consistent, or language is not consistent across environments. And if there's, if the child is feeling stressed or not feeling safe or feeling overwhelmed from a sensory standpoint, their communication skills may decrease, or they may choose not to talk. So this sounds to me like potentially feeling comfortable and supported at home, feeling more comfortable, able to tap in and access his true language skills and use it in a place where he feels safe and comfortable. And then potentially school is a very different setting. So maybe lots of sensory information coming in, taking up space in his brain, lots of emotional information that's taking space in his brain. And he may and lots of social demands, cognitive demands. So that space for really tapping into his expressive language skills may just not be, he may not be able to tap into that at school because it's such a different context. So I understand your concerns about his ability to participate in school. So one thing that I consider is, are there other multimodal communication strategies he can use? So visual systems, picture supports. He sounds like too young probably to be writing yet, but some other way he can get his point across. Jesse, I just saw you raise your hand. Do you have something to say? I'd love your input.
Yeah, I thought we could speak to this a little bit because I would say Stella had a very similar experience. So her stroke was on her last day of kindergarten. She did most of, the beginnings of her treatment and everything, and stabilized over the summer, and then went back to school in first grade. And she, for that first year, she would be making lots and lots of progress at home with her language, and at school was almost silent as well. And in many ways was socially just apart, because it was so overwhelming for her that she would really spend a lot of time getting comfortable into that environment. This is with all students that she knew before her stroke already, but even still, it took her years really to get to a point where she was comfortable, jumping in verbally, socially. And it wasn't that she felt isolated necessarily. It was just that she was processing what was going on around her. And there was so much for her to process that she was perfectly comfortable just being there, observing it, getting back into the swing of it. And but having said that, by the time she was in like 5th grade, she was very much comfortable, back to normal, speaking the same at school as she would at home and all of that. So it really equalized over time. You want to
That's
ask?
good to hear.
Yes.
What do you
So I remember like I did open up more in like in older grades, but we played capture the flag at the end of the day for like, I don't know, like 2 hours or something. And I would just and I just like remember just hanging out with the teachers more than the kids, probably because I didn't want to run, because it was like a running game, but partly because I felt more comfortable with the teachers than the kids.
Yeah,
I think this is fantastic. And also, Stella did not like to talk in our multidisciplinary clinic with 7 people in the room. Just the first few years, I get to know all her wits and the expressive language later on. But I think you guys are touching exactly on what is understanding what's going on. And I would say wanted to make sure that something comes through. Even a shy is not a bad thing. And it doesn't impair you from succeeding in life and having a very meaningful set of relationships. The question is he having a good time in school, or is it really distressing to be in that environment? Like Stella just told us, she felt more comfortable with the teacher, but she was still okay and having fun, and it was a comfortable environment. That's more important. Does he have meaningful relationships in school? And doesn't matter if it's exactly the peer kids, or if it's a teacher, or if it's an aide, or if it's someone else in the school that they're comfortable with and they're thriving with. So that, going back to social communication skills and having language to be developed and relearned in a more comfortable environment, I think is very expected, is natural to happen. And it's a good thing that is happening that way. Safer to have mistakes, to say words that don't make sense, or even sounds. And also like the non-speaking part. Remember the babies, they're not born talking. They're experimenting with a lot of things. But when you're a 6-year-old or a 5-year-old, you don't want to be in the school saying ba 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 to see how that sounds versus da da ta ta ka ka. Like, you're not going to be experimenting with this in public, most likely, but you may want to do it at home. So there is a curve that is being recreated to regain that skill that I think it will probably most likely be happening where the kid is most comfortable.
Megan, do you want to ask your question about social skills?
Sure, thank you. I feel like a lot of the answers have been helpful. Even just what you were mentioning about being more comfortable and talking more then. And I guess we're just at that school age point where we're interested in trying to find some of those more comfortable environments, specifically, we just noticed that so many of her typically developing peers, she learns so much from them, but as she gets older, they seem a little, I understand I have older kids than her too, a little less patient and waiting for some of the words to come. And as much as they're interested and kind, Brenna, you want to play? And it takes her so long to answer yes that they're kind of off and running before that yes comes out, and then that opportunity seems more missed. We've just been suggested to try some other groups and ways to get her around some more peers, and so I'm just looking for resources to support that and create that confidence.
I saw your question in the chat too. I think it is difficult. That's why we have these seminars going on. To find the resources is a very creative and full-time task for families. And the things to explore is if you can find any adaptive sports, adaptive activities, that's one opportunity to try to be with more like peer kind of group of people where she can also see that they might have different difficulties, but they're also having difficulties and that they're also having fun and enabling that play with others where she feels a little bit more at pace, if you want, like at the same speed. And we found that is really dramatic, that what it does to even the regular play time in the breaks in school. Because once they get to experience that they can play, and maybe it's not about answering yes or no or saying something, but they can do it their own way. And they can also learn their skills, and then they're more confident. It's about developing their own confidence. And you are right at the time where I will also recommend, and I don't know exactly when the stroke or where it was, but if there is a language difficulty, I would make sure that there is an auditory processing evaluation, regardless in which side of the brain the stroke was. Because sometimes it can be helped a lot, not so much in the playtime because those are very chaotic moments, but in the classroom and for participating. Sometimes we find, and this is more new things that we are learning from the families, that is all about just helping with that. So taking some of the load that Emma was talking about, they are dealing with a lot of processing and a lot of noise, and maybe trying to get the voice higher in volume, that simple as a speaker for the teacher, or systems that can be coming out of that auditory central processing evaluation. And she likely is in the age, she's 8, that she can do a full one. And that will have impact on the 504 and the IEP. And starting to do these things where we enable the environment to them, it's also helpful. And then reducing the play date to smaller groups, not big, large, everybody screaming, might be another thing. So maybe bringing people, this is COVID time, so all with the recommendations, the restrictions, but bringing people and bringing her to a small play dates, not maybe 2, but more than 2, but not 10. And maybe going somewhere where it's kind of neutral territory, a playground, a park, to meet with other families, maybe a very nice in-between, like home alone and classroom, which is much, much larger. I don't know, these are some ideas.
Well, those are very good ideas. I appreciate that. And I think that it also helps a little with her school. We're just kind of, she's finally starting to say things and has a lot of ideas. So maybe the auditory will help, because we're kind of looking for technology support, because she has so much she wants to say, but her writing isn't on point yet. So, you know, for her to do a story or tell, like she has a lot she wants to tell, but to get that onto paper or into print. So we're trying some technology to voice to text sorts of things, but the slowness in her speech and the articulation isn't always great. So we notice there's a lot of errors, even with Alexa, even with Siri. You know, we're just trying all these things to help her get her ideas out, but they don't always recognize what she's saying.
They will be trained by her. Like Dragon dictation systems is a very advanced system that we use for notes for patients. If I do use Dragon out of the shelf, you will have a note that says horrendous things because it misunderstands a good number of my words for others. And just because they need to be trained by her. So, but this is where I think, honestly speaking, an audiologist may have a lot of capacity to inform and how and what systems can be used. And sometimes it's not just taking away the possibility of writing it, but allowing for when it's needed to get done, and she needs to get over something else. Because if not, you also, from just having to do that task, impair the entire afternoon, the evening, because she has to finish that and she's not able to do it. So the way I think about it is like, yeah, it may not be what a school is recommending sometimes, but it will enable a lot of more things at home, for example, when homework needs to get done. So why not? There has to be a more heuristic kind of approach to the problem as you're having. But see if you can find an audiologist that does central auditory processing and get a referral to that. I think that could be helpful to bring other ideas to the table.
That's great. I listened to that education series just recently and earmarked that I wasn't sure if that's her or not, but she's the age. So like you said, why not? But thank you all. This has been a lifesaver to have these sessions. So thank you.
And I think we are at 11 a.m. on Eastern time. So it's 2 hours.
So here's what I'm going to propose, that we end now, but I recognize that there are still questions in the chat. So what we're starting to do in May, we have 3 events scheduled in May, and one of them is a Q&A follow-up on the constraint-induced movement therapy session that we had last month. So I think we'll take these remaining questions in here, and if Emma's willing, we'll schedule just a 1-hour session to answer those questions, and anyone who wants to join can ask additional questions that fit in that time. And we'll get that on the schedule soon. So I want to remind everyone to sign up. There are 3 events scheduled for May. May is Pediatric Stroke Awareness Month, and we hope you'll continue to join us. Thanks so much.
Thank you, everybody. Have a good weekend.
Thank you.
Hi, thank you all.
Thank you
Thank
all.
you.